In olden times, knee pain was seen only in old people. But in these recent times, knee pain is there everywhere. It starts at an early age. To brief us on the spectrum of the latest techniques, how to treat knee pain, we have with us Dr. Faizal M. Iqbal, orthopedic surgeon, Aster MIMS, Kottakkal. Hello, doctor.
Hello, Rashmi.
Can you just brief us on the knee pain and how do you treat it?
Yeah, as you rightly said, knee pain is the most common problem that is affecting our population. Especially nowadays, we see a lot of knee pains in the younger generation also. Why? Because the lifestyle is faster. The sports have picked up very well. Patients are a lot more into active sports and high-speed injuries. I mean, you're riding a bike or a car and a lot of accidents happen these days. So wide spectrum of degenerative disease coupled with your lifestyle end up in knee pain. So you have a lot of spectrum of pain coming from children from 15 years to people 75 years. So all of them need different approach and treatment.
At what point of time do you feel we should meet a doctor? Or, at what time you start a treatment for a patient?
Yeah, knee pain, as you know, is quite debilitating for any patient. You start getting pain at the night, you start getting pain when you walk, when you're doing your regular routines. Definitely pain is a warning sign from the body that you have some problem at your joint, whichever, left or right knee. So when you have a pain, just don't ignore it, because it can be due to biochemical problem like uric acid going up, or you have any other biochemical changes. It can be treated very easily with medicines. So once that point is gone, the pain starts continuing. So and you can recollect any injuries like which has happened say 2 months back or 3 months back. A minor slip is enough. So that can give rise to derangements in the knee, like meniscal tears, ligament tears. So those have to be dealt at the right time. So that's why the younger population tend to ignore them. So they end up with arthritis at an earlier age than expected.
Yeah.
So you have to diagnose them. A simple MRI can show that your ligaments are torn, your meniscus is torn. So an arthroscopic surgery is the best thing to deal with. If at all you don't need a surgery, you can brace the patient properly, medicate the patient and rehabilitate with exercises, physio. Most of the ligament injuries heal. But if it needs a surgery, it has to be done at the right time so that you prevent an arthritis at a later age.
Okay. We have heard about the term knee replacement surgeries.
Fine.
So can you just tell us what exactly is it, and at what point after which treatment you get into the final stage of a replacement?
Knee replacement is a treatment when the doctor decides that this knee cannot be salvaged.
Okay, anymore.
So yeah, anymore, because you have different grades of arthritis. Once the point is beyond grade 3 or 4, that is, there is loss of joint space, there is deformity, you see the patient's bowing or bowing out or bowing in, then you know this deformity cannot be corrected by medicines or bracing. Then the patient's age has crossed beyond a certain limit, say 50 years plus, then you think of a replacement. Even in replacement, you don't need a total knee replacement these days. If you can pick up early, the arthritic level at an early age, patient just needs a unicondylar replacement. Which side is damaged, you can replace with a unicondylar knee. It's called the daycare or daycare knee surgeries, so which we have been doing quite often, and can be done with a very small incision, and the patient starts walking the same day. So even in total knee replacement, there is no need for any phobias or all. Patients are doing very well. After 3 days, patients are walking normally. So, and as you said, rightly said, how to prevent it. There are other treatments. When you pick up the arthritis at an earlier stage, say grade 3, you can do a lot of newer techniques called orthobiologics, where you can inject the patient's own bone marrow, processed bone marrow, patient's own platelet factors, or you can inject stromal cells which you can harvest from the patient's own abdomen, fat cells. So it's called SBC, stromal cell factors. So those are acting as stem cells, which we are injecting into the damaging or ongoing process in the knee. So that can prevent that progression and the arthritis can revert back, provided you pick up the arthritis at an earlier stage. So there are a lot of innovations happening. So I think the patient should avail that, and even knee replacement are becoming daycare surgeries these days. So
okay, it is really nice to know that even a knee replacement is, it is more like a daycare procedure wherein the person can get back to his routine in a very minimal time, which is an amazing technology, doctor. Thank you so much, doctor.
Thank you so much.
And thank you, viewers. As we always say, post in your queries and doctor will be answering his queries. And this is Aster's Let's Talk with Rashmi. Thank you so much.